The Saskatchewan Party examined the 2011 provincial budget over the two-day meeting. They also looked at two main priorities, the economy and healthcare. In an attempt to reduce surgical wait times to 3 months, the government introduced a new initiative this week that will see dental and knee surgeries performed in private clinics outside a hospital setting. Premier Brad Wall expands on the government's plan.
This plan that we've outlined involves us using all the facilities in the public system to a greater degree, including regional centres where we have operating facilities in a place like Swift Current and a brand new hospital, but also to use other partners, nonprofit partners that aren't government and private partners as well, as long as it's part of the public system.
Wall goes on to explain this initiative will be funded entirely from government funds and residents will not be able to use their own money to get ahead on the surgery waitlist. Right now, there are two private centres, one in Regina and one in Saskatoon, which are performing the surgeries. Saskatoon MLA and NDP health critic Judy Juner expounds on why she feels this is a shift towards privatized healthcare.
Next year, they're going to put out a request for proposals. So that means opening it up to anybody else who's interested, which is a message to me that some other people will start having that sort of enterprise. So that will make it a bidding war for health services, because that's what he's actually signaled. That's what he said. Come to Saskatchewan and bid on our surgical procedures. That's a big signal that it is open for the private sector to come in. They can't very well say that it's not opening the door, because it is.
Those critics want to give Saskatchewan people ideology and dogma when Saskatchewan people want health care. I would say that as long as it's part of a public system where nobody can jump ahead of anyone else because they have more money, where everyone can access it in a universal way, as long as we keep those principles as a part of what we're doing, then we need to deliver on partnerships.
After touring facilities in Swift Current this week, Juner says there are public resources in the southwest that are not being utilized, which could help to lessen surgical wait times in the province.
Has the government maximized the use of a Swift Current hospital? That's a question I think people would need to know. And that many people go to Regina and Saskatoon for surgeries that perhaps could stay here and have them done. Invest in our own facilities, in our own community, in our own public health system before you start doing this.
The surgeries performed at the private clinics will be done at approximately the same cost to perform them at a hospital. The Saskatchewan Party says their goal is to reach the 3-month surgical waitlist by 2014. For Southwest TV News, I'm Kara Rapke.